Greetings, everyone. How you doing today?
Hmm.
Good afternoon, everybody.
Hey, Bobby.
Hi.
Hey, everyone. It's 101. Just checking out everything right here. Got
Is
about 50 people on the call right now.
Kurt, I was gonna
And
ask, is anybody on the phone that we need to make sure they get attendance credit?
I agree 100%. If any one of you are on the phone, not joining through Zoom, let us know so we can take attendance for you. Again, this is for people on the phone. So put your name in the queue or just
Hi.
speak up and say hi, who you are. Who is this?
Hi. Hi, it's Tracy Heller here.
Hey, Tracy, how you doing today?
Thank
Hi.
you, Tracy.
Hi.
I'm glad you're here today.
Oh, how are you
Renee
doing?
Farmer.
Hey, Renee Farmer, how are you?
Fine, thanks.
Who else we got on today? All right. Since I'm not hearing anyone else, please speak up. Or if you join and have not had the opportunity to speak up, just put your name in the queue in the chat. Well, 1 to 105, Bobby, we're doing the welcoming here. Hey, welcome everyone. I like to always throw my 2 cents in right away that this is your meeting. We are the participant directed program policy collaborative. And Jessica, I was just wondering, are there any new people that you wanted to ask if they've signed up or pull them right away?
Sure. Hi, everyone. Jessica Corral here. I see some new names, I think, in the participant list. So let's get this poll kicked off. It is for individuals who have never been to this meeting before. So if you're coming for the first time today, go ahead and fill this out. And it should be visible to you if you're logged on to the meeting through the internet from your menu at the bottom, polls/quizzes. Might also pop up as a window.
Okay. And while you guys are doing that, I'll just throw out there one more time. This is our meeting as participants. Feel free to speak up. We want to make sure that no one feels intimidated to speak up on any of the subjects. I do ask that we stay on subject. And if you get a little long-winded on it, repeating things, I will just ask you maybe to wrap up just so we can stay on schedule. And of course, to let other people have that opportunity to also get their word in. Um, we do understand if you get passionate about something. I want to remind everyone to not confuse being passionate about a subject with being angry or angry at someone. So again, we do encourage complete and open participation. Again, be mindful of the agenda. We really try to stay on track. And then we do have certain things like open forum. We can pretty much bring up anything you want, keeping in mind is not there to solve the problem necessarily at that time, but certainly if it seems well worthy, we will make sure to add that at a future agenda to make sure you get those problems addressed. So, how we doing on that survey, Jessica?
I think we're good now, so I'm going to end it. Anyone who didn't get a chance to complete it, just send me an email. I'll put my email in the chat, or you can call me at 303-866-3504. Thanks.
Awesome. All right. All right, Bobby, I think let's why don't we get into doing an open forum. Basically, we are just talking about it. We are a little bit ahead of schedule. But we seem to usually need that time someplace else down the road. In any case, anyone who has any topic you would like to bring up, mention any announcements, anything particular that maybe needs solving, please feel free to raise your hand or put your name in the queue, and then we will make sure that that happens. So anyone with any open forum items?
Renee?
Okay, Renee, we got you in the queue. I got Amanda, I got Megan. All right, so since you're on the phone, Renee, let's go with you first.
Is there a reason that open forum 2 is not on the agenda? I've noticed that, I don't know, a couple months ago also, was that changed? And there is no open forum 2?
You know, I don't know how to answer that, other than maybe it was inadvertently. Danny, you got an answer on that, or Bobby?
Kurt, didn't we eliminate that one for the hour-and-a-half meetings or not?
Huh.
Bobby, this is Danny from HickPub. Sorry, I couldn't figure out how to raise my hand and share the screen at the same time. A while back when we switched to do the hour-and-a-half meetings, it was discussed that since the very end of the session is the breakout rooms, that the meeting would end after the breakout rooms. And then when we have the longer 3-hour meetings, the open forum is available twice.
And that certainly makes sense. I think a big part of it is we had 2 forums because people either didn't get it on time or they couldn't set their things. But we do have a meeting wrap up, and I think I'll make sure to include that as part of if there's any final questions. But I don't think we need to have as a agenda item per se. All right. Megan, I got your hand up next. What do you got going, Megan?
My question comment thing is about overtime that we've ran into now that live-in family member caregivers are allowed to work more than 40 hours in a week under CDOS, under CFC, love the alphabet soup. Whether or not those live-in caregivers are allowed to be paid overtime. And HICPUF was saying yes, and the FMS was saying no, and citing different regulations and state and federal regulations. And we're in the middle as a ping pong ball between whether we're paying overtime or not, which seems like it should apply for not just CDOS, but would also apply for IHSS through agencies too. So that living caregivers and overtime sort of piece has become a deal recently.
We'll
Sorry,
address that with, go ahead, Danny.
this is Danny from HickPuff. I am so sorry. I cannot figure out how to raise my hand while I'm sharing the screen. So apologies for cutting in. But to answer your question, Megan, thanks for bringing this up. Caregivers, living caregivers and family members under Colorado state law, with the exception of very few individuals, should be receiving overtime. And we are currently working with the FMS funders to ensure that that process is being followed. So if this has impacted you, we are working on investigating the issue a little bit more, and we'll make sure the FMSs are following up with you very soon about next steps and additional information.
Sounds good. I got another email from them yesterday evening or this morning saying, nope, here's the rule why you don't pay overtime. And I was like, so thank you for continuing that. They haven't gotten it yet.
Would you mind forwarding that communication, please?
Yes, I will.
Thank you.
I know there's some clarification on that regarding the Department of Labor. And Danny, I think I've sent you a copy of that information. So I'm not exactly sure how that necessarily applies. I'm not legal counsel, but I do read quite a bit and thought maybe the board should follow up. So any other questions regarding that? Thanks for bringing that up. McKenna, I see you raised your hand, but Amanda's had her hand up for a while. So Amanda, ready when you are.
Thank you, Kurt. And hi, everyone. It's Amanda Smith over at the department, IHSS Policy Advisor. Happy PDPPC Day. So my open forum is an announcement. As We've been identifying from stakeholders and just from rule review, we identified that the IHSS rules are currently living in two separate rules and regulation documents. This was an oversight by the department because the 8.500 rules were intended to be repealed during our case management redesign, better known as CMRD. So with that, we are repealing the rule from the 8.500 rules so that we have our rules and regulations all living under one rule deck. So again, the most current up-to-date rules are in our 8.7 thousand. There wasn't many changes outside of our CFC, of course, and including kiddos to be able to utilize that personal care homemaker. But just want to relay that those will be repealed, and then 8.7 thousand should be the rules that we reference to. So just wanted to make that announcement. That rule is being ran, I believe, in this coming MSB session. So that'll be coming up shortly, so that we could have all of our rules living in one spot is our goal. So
Amanda, could you put a link to that in the chat?
absolutely. I will put that in just a second. Thanks, everyone. Thank you, Kurt.
Thanks, Samantha. McKenna, is that how you pronounce your name? Welcome.
It's
So you got your
McKenna.
hand raised. McKenna, my apologies.
Yep. No, you're okay.
Ready
I
when
just
you
wanted
are.
I just wanted to introduce myself. I'm new here to HICPUF. I'm with the PDP. I'm a Master's of Social Work student intern, so I'm super excited to be on this team and be on this call. I'll be more in the stakeholder engagement role, so today I'll mainly just be observing, but happy to be here. So yeah.
Welcome, welcome, welcome. Hopefully you find our group interesting, if anything. All right. And I see I have another one here in the chat. Lisa, you mentioned you're in the chat, but couldn't raise your hand, so now's a great time to step in.
Okay, thank you. Can you hear me okay, Kurt?
Yes, we can.
Oh, perfect. So, yeah, thanks. I don't always sign into a lot of the meetings, so thank you. And I was excited. I looked at all the topics on this, and I was excited to hear and go over stuff. But what I was just going to ask was, in my particular situation, for our son who's a quadriplegic, is that my husband and I do all of the hiring, the firing, the managing, scheduling of the caregivers. And I wanted to, at some point in the meeting, maybe address that and what that looks like in form of a task and what task that fits under.
Okay, we'll definitely add that in there. Before I'm not trying to solve your problem right away, what waiver are you is your son under?
He's a CDOS, and it's the integrative health. Used to be spinal cord and is now the integrative health waiver.
Okay. Are you excuse me, I gotta clear my throat.
I don't know if you want me to provide a response. This is Danny from HICPUF. I don't know, Lisa, if you want to open this conversation up for further discussion, or if you'd just like a quick response now. So I guess I'll ask you, would you like a quick response now, or are you proposing this as something to open up for further discussion?
Well, and depending, maybe the answer is both.
Okay.
Because I personally don't think it's probably a quick response, but I mean, you guys are pretty informed. So a quick response might be really helpful, and maybe we could touch base with it for a few more minutes, a little bit in the meeting if we had time, which I'd appreciate.
Yeah, let's do that. So what you were describing sounds a lot like the authorized representative roles, the responsibilities, for hiring and firing and doing the employment requirements. And under CDAS regulation, and this is also a federal requirement, authorized representatives are not permitted to receive payment for doing that within CDAS. This topic has come up a few times in PDPPC, and I know that there has been some discussion previously about ways to better support authorized representatives, because we do recognize that that is quite the role that people take on. And so I think if it is something you'd like to further discuss about ways that those authorized representatives can be supported, I think connecting with Kurt and or Bobby would be a really good starting point so that we could get it on the agenda for a future meeting and have a more comprehensive discussion.
Okay. Yeah, in this case, so my husband is my son's authorized representative, and then I'm a caregiver, live-in caregiver. But I do all of that. So not only do I do, some of the care pieces and et cetera, but I do all of the managing, all the paperwork, all the advertising. I run the business basically. So it's myself. And, because my husband doesn't have time, he works, so he acts as the AR, but there's no way he has the time to do all of that, and my son can't. It's a role that I do. So maybe discussing a little bit more would be awesome. I appreciate it.
Yeah, and happy to connect too with you offline if that's helpful. I can put my contact information in the chat if that would be helpful too.
Oh, great. Yeah, that would be helpful. Thank you.
And Lisa, feel free. I'm going to put mine as well. I work with Consumer Direct, train people on this program. I'd be more than happy to give you a little advice and from what I have from my personal insight as well. All right.
That would be great. Thanks so much.
Okay. All right. Anyone else have anything to share regarding open forum? We're just a few minutes ahead of time. We can maybe take another topic or two.
Can I bring up one more thing?
Sure.
The other thing I just wanted to mention was, and we're CDOS and we're with Palco, but I was talking to a good friend of mine that's also a quadriplegic, and we were talking about at what point could the forms be filled out online, completely online, using Acrobat or something of the sort, so that forms didn't have to be printed out and et cetera. Just making it so much easier for the not only the person applying, but for the person managing the caregiver and bringing the new person on, just the employment in general.
I'm going to throw that right. I think Kathy is here from Consumer Direct. Kathy, if you are here and available, do you have an answer to that?
Hey there.
Check. Hey, Kathy.
Sorry, I thought we were talking about the FMS enrollment forms. Are we talking about CDCO's forms to be fillable?
CDCO forms regarding to be filled out for part of the whole process.
So yeah, we've been working on our piece. And I don't want to speak for PPL and Palco, but I believe they have been as well to make the fillable PDFs, Lisa, so that it relieves that part of the stress and try to print it out and things like that.
Oh, perfect. Okay, so because as far as you know, Palco and PPL are not doing that yet, correct?
I think we should, yeah.
I'm sorry, they do have that online on their websites. If you go under program documents, you can also call the FMS and they can walk you through that. For the most part, they're fillable online to be saved and then signed and sent in. But it is a bit of a process, and let them help you with that the best you can.
Okay. All right. Well,
I think we can talk to, and I will share, I think we probably have some people from Palco and Public Partnerships on here, and they can address that maybe a little bit later. All right.
Okay. Thanks so much. Appreciate it.
All right. All right. Anyone else? I think I saw Jessica. Did you have your hand raised or someone?
I did, Kurt.
Okay.
I just was going to respond a little bit to that last point, but Lisa, I would encourage join our FMS training case management breakout room, and we could probably get into more details to help answer these questions for you.
Okay. Thank you.
Great point. All right. All right. Well, we are right at 1:20. If we have nothing else urgent happening right now, I'd like to step into our next agenda item. We've allowed a bit of time for it because it's been quite a subject here lately. So we're going to talk about the nurse assessor, member resources, and Aaron Thatcher. I see you're on. I appreciate you bringing us into that.
Hey, Kurt. Hi, everybody. It's so nice to see you here virtually today. I'm going to need some help from my teammates on sharing some documents. And we heard from several of you that you'd like to walk through some resources that might be available. And these were mailed out to the snail mail folks as well as emailed to the group. All of the documents I'm going to be going over are available online, and they're resources for anyone who might be needing a little more information on our skilled care acuity assessment, the nurse assessor, and then some of our resources for self-direction for both consumer-directed attendance support services, or CDAS, and then in-home support services, or IHSS. So I'm going to walk through some documents. I'm not going to go like read them line for line, but I want to describe kind of what they are and then the purpose behind them and how they might be helpful for you. So the first one, and thank you for sharing here, is the Nurse Assessor Member Guide. And this is describing the nurse assessor and the skilled care acuity assessment. This began August 1st, and this is for anybody who might have skilled care needs. We are transitioning to one vendor to do a holistic assessment of skilled care that can be used for a variety of different services, including CDAS HMA or IHSS HMA, private duty nursing, or long-term home health. I think what's important to note here is that this, although it just went into effect, we are working through assessments right now. It really will come up for you if you have an assessment, a continued review coming up in the next couple months. Your case manager will submit a referral to the nurse assessor, and then they'll reach out to you about conducting an assessment. In a short version here, that assessment will go over the skilled care needs. The assessment is conducted by a nurse, and that nurse will go through all of the skilled care needs that you might have, and then they'll document those and then provide a recommendation letter. So a couple of things here just to note is that if you don't have skilled care needs, you probably won't interact with the nurse assessor. Secondarily, the nurse assessor does understand self-direction, so they do know that our benefits don't require a nursing licensure. We waive the Nurse Practice Act, and so they're really not concerned about who's doing the care, more about what care is needed, and then they give you a recommendation so that you can decide how you get your care needs met. So one example might be if you're on CDAS and you are happy with CDAS, and you have some skilled care needs, they'll identify those, and your case manager will work with that recommendation to get your PAR generated, which generates your budget. Jessica, do you mind scrolling down a tiny bit? Okay, a couple things to expect. So Telligent is the vendor who is the nurse assessor, and they'll schedule or they'll contact you to set up an appointment. This, again, is started by the case manager. They'll put a referral in when you have a continued stay review assessment coming up. It's usually about within the 60 days prior to your certification start date. The assessment can be done virtually or in person, and they talk about, again, skilled care needs. So if you need a catheter changed, or if you need injections, or if you have a bowel program, all of those skilled care tasks will be identified in this assessment. And then finally, the recommendation letter is provided just telling you, hey, we've identified some skilled care needs, and here's what the hours kind of look like. Please work with your case manager or home health agency to get those hours in place. So some reminders here. Number one, if you get a call or a message from Telligent, please respond quickly to get that scheduled. There is a pretty big backlog right now. So if you've reached out and you haven't heard back and you have an assessment upcoming and you're worried that you might be delayed, please feel free to reach out to us. We can try to get maybe an escalation internally to get that assessment done quicker. And then we are working on, so I'll just say we're working on a lot of guidance right now for case managers, and hopefully getting some additional information out to you all shortly about the nurse assessor process. But the main thing to know is if Telligent calls you or text messages you or emails, please respond so we can get that scheduled. And then let's see here. Jessica, do you mind going down a little bit more? Okay. If you have not been contacted prior to your continued stay review or assessment, please reach out to your case manager or home health agency. And then in terms of all of this that we're discussing today, we have a website that has been developed. It's got a lot of resources on it about the nurse assessor and what that process looks like. If you need help, like let's just say you are not an online person and you can't access the internet, please reach out to us. I'll put our phone number, or I'll have someone put the phone number in the chat that you can call us and we can walk through some resources for you. Okay. Any questions about this document tonight we're sharing? Okay, we're going to move to the next one, and whichever one you pick is fine. Thank you. Okay, so this one might be familiar to all of you. This is the Health Maintenance Activities Documentation Guide, or HMA Documentation Guide, and this has been updated by our team in order to transition to Community First Choice, or CFC. So this guidance was developed several years ago with stakeholders. Many of you were part of this, but it was developed to help people figure out what makes something skilled, especially when we're talking about something that might be on like in the middle. It might be personal care, it might be skilled. This document helps us figure out like where something fits. So a couple of things to note. This is available for anyone to use, but it's usually used by your case manager when they're working on developing a PAR. In addition, we've got something called age-appropriate guidelines, which helps us identify which needs are applicable for children, because as we know, children are very different. They're not just little adults. So we've got guidelines about what's parental responsibility versus an actual care need that is extraordinary for that individual. And then lastly, we're really looking at the assessment that the case manager is doing and making sure that they can help document in a very straightforward way what your needs are. So again, while this is a case management tool, anyone can look at it. And I find it pretty helpful if I'm thinking about how would I describe what the needs are for a specific task so that I can make sure I get the support I need. So we're looking here right now at skincare is like the first one of our tasks. And on the left column, you'll see the skincare rules, which are outlined in 8.7. And these are consistent between CDAS, IHSS, and even our other skilled benefits like private duty nursing and CNA. So we've got our rule criteria here. These are in little check boxes, but if you meet one of the criteria here, like for example, if you have a chronic skin condition that's active and could potentially cause infection, you would qualify for health maintenance activities or that skilled level of care. We also have a little box here, or a little place for special consideration. So other things to just think about, if you've got paralysis or if you're unable to reposition, that could make things really challenging. So skincare being skilled might be appropriate for you. And then on the right column here, we have documentation needed. And as many of you know, in self-direction, we don't require the same type of documentation that traditional home care agencies rely on. So we're not getting like doctor's orders and prescriptions for things. We're really saying, yep, we know you have this need. You've been prescribed a bath chair, so we're going to help you with your bathing or skincare, what have you, and making sure that that's skilled and outlined in the assessment. So our documentation needs here are really, what do you have open wounds? Do you have any kind of medications that might be needed for this? Is there a history of complications ongoing, like chronic wounds or skin conditions, that kind of thing? And then there's also a little place for kids, what other things might we be considering? And that's where we'll go into like age appropriateness. So For the HMA documentation guide, this document it's 10 pages long. So we're not going to go through the whole thing here. We're showing you what it looks like. It has every single task that's available in HMA or health maintenance activities, and each section goes through the same process. So it includes the rules, special considerations, and then what kind of documentation is needed to help make sure we're documenting things appropriately. And again, documentation is really, it depends on the person and what they might have. And a verbal description could be enough, but your case manager is going to need to hear that from you as a member, or if you're an authorized representative helping with assessments or anything of that nature. So this tool, the HMA documentation guide, again, it's pretty old. It's been in place for, I think, back to 2021, maybe even before that, but we have updated it for Community First Choice, and there's updated rule citations in here. So please feel free to use this if you are curious about what makes something skilled versus unskilled. Okay, I know that was a lot. Any questions about the HMA documentation guide? Yes, Amanda.
Not necessarily about the guide. However, we do have a few questions in the chat, not related to the guide, just general questions about nurse assessors. So I don't know if you want to take those now or once we get through what documents were shared to touch on those.
Okay, great. Thank you, Amanda. I appreciate it because I'm not looking at the chat. Let's go through the other two documents I think that we're going to go through today, which are the task worksheets, or sorry, the direct care services calculators. Okay. So we're going to do a little history lesson here today, folks. So you may remember, if you're a longtime CDAS participant, we had something called the task worksheet. Y'all remember that? Okay, so we had that in place for a really long time to help determine the needs of homemaker, personal care, and health maintenance activities. And the case manager would work with you to fill it out. And there was a little box for like the frequency of the task and the duration, and it would populate a number of minutes. And those minutes are plugged into the allocation worksheet, and it helps to develop the budget. So we use this task worksheet for a long, long time. And then in IHSS, we had a very similar document called the IHSS Care Plan Calculator. And that was in place back beginning in 2018. So in the move to Community First Choice, we recognize that having a bunch of different documents for the same purpose didn't make any sense. So we worked with stakeholders in the Community First Choice work group to combine the two documents into something comprehensive that could be used by both CDAS and IHSS participants. And in all actuality, we're using it for anyone who needs personal care or homemaker services. So it's not just for self-direction anymore. So the new document is called the Direct Care Services Calculator, and our case managers have been using it back, I think they started in April. So it's possible you've seen this already. If you haven't, we do have it posted online. And again, we've sent it out to the snail mail population. So this worksheet has a couple of tabs. So right now we're on the calculator tab, which has a section for homemaker, personal care, and then there's also health maintenance here too. So a couple of things to note is we have norms here, which norms are like the typical amount of time something would take. So for example, actually, could you go back to the direct care services calculator one real quick? Okay, great. Thank you, Jessica. So floor care, our norms, which were established a really, really long time ago, like in the last century, 15 minutes per room per week for floor care is like what might typically be provided in a homemaker task. And so the case manager would meet with you and just discuss your needs, and they determine, okay, we're going to do 15 minutes per time, 3 times a week, and then it calculates out a number of minutes per week. And so you go through all the different tasks, and then if we want to scroll down a little bit, I'll show you kind of the bottom half of it. You type in all the things and then it calculates. So there's homemaker, and then there's a place for the legally responsible homemaker provision, personal care, and then the total. And so this is what's used to help generate the budget. Okay, can we skip over to the age appropriate norms and definitions? Okay, great. So right now we have 2 direct care services calculators, one for adults and one for kids. Because again, kids are very different, and depending on their ages and their abilities, there's a lot of things to consider. So one of the things that we've developed with stakeholders and with we did a contract with the University of Massachusetts to help develop additional resources for age appropriateness. We came up with this sheet that you're looking at right now, which is the norms for different ages. So for example, if we're talking floor care again, a child under the age of 5 is probably not going to need any floor care because it's typically provided by a parent or caregiver. However, as the child gets older, if their disability results in, I don't know, a lot of mess and things that need to be cleaned up, we can approve floor care as an extraordinary task that would be provided by a family member or someone else. You could have this task provided by whichever caregiver you want. So we've got different buckets of let me describe this in a different way. So the chart here for homemaker and personal care has the task, and then the definition, and then age brackets. So the first 5 years, 6 to 10 years, 11 to 14, and so on and so forth. So the age appropriate guidelines are really for kids under the age of 18, and then adults doesn't really apply at this point. So direct care services calculator is a new name for something that looks a little different, but it has been in place a long time. And it's that way to figure out how many hours of service you need, and then that's taken to put into your budget. Okay. Any questions about this document? And then we can go to the chat. And I'll just mention all of this is available online. It's, if you're a member and you're like, I am just curious, what this looks like. I want to be prepared. I want to know what to expect when I'm going through an assessment. This is available, and we'll put the links in the chat if you'd like to look more at what these documents look like. All right, Amanda,
Karen, I got
or
a quick
Danny,
question.
Oh, sorry. Go ahead, Kurt.
Sorry about that. Sorry. I just noticed that the norms seem to have changed quite a bit from what they were in the past. Just wondering if there was any.
So great question, Kurt. So we have a couple of distinctions here. So first, the one we're looking at here is the kids calculator. So we never had norms for kids because we didn't have personal care available in CFC, and then homemaker is a new thing for a lot of members. So we didn't have norms available for kids. So on the other worksheet, the adult one, you'll see the norms as you expect them. And norms are a guideline. It's a way to just start with okay, how long does it take to do this? The case manager has authority to adjust if needed.
Okay, I just noticed, for example, bathroom. This again was for the adults, of course. I just saw some changes. No big deal. I just was wondering, and maybe it makes more sense. So, just wondering.
Oh, good question, Kurt, and thank you for the call out. I think when we're talking about assessments, as a member or a representative of a member, it's really important to be able to describe what the needs are and why they may be different than what the norm is. And the one I use all the time is that, for example, toileting, it might be 15 minutes per time, but for my kid, it's 45 minutes, and that never changes. So if we can describe that, it's helpful to ensure that the case manager can document that in the assessment.
Great, that's what I was hoping to hear. And then Bobby, do you have time to answer her question, Karen?
Bobby, yeah. So I might need help with the who's hands raised and who's in the chat.
Bobby has her hand raised. Go ahead, Bobby.
It's not really a question, it's an offer. If anyone has trouble finding information anywhere and you can't get a hold of a person at the state, you can always contact me and I will help you find the information you need and email it to you.
Thank you, Bobby. That's so kind of you. And yes, we appreciate that so much. And Bobby knows how to pull a flare if needed, if we need to get involved. Okay. Okay, Amanda, please keep me honest and on time because I know we're at 20 minutes, so like we don't have a ton of time here.
We don't. Yeah, we have about 4 minutes until we get to our next topics. I'm going to try to run through our questions. There are a couple general themes, but our first one's from Angie from North Metro. She would like to know, do you know how delayed the nurse assessors are? And if there's a time frame that folks can expect currently, I'm assuming for referrals and assessments.
Angie, that's a great question. So I'll just mention we definitely are behind schedule. The nurse assessors have a lot of referrals that they're working through right now. So what we are doing is making sure that the nurse assessor webpage is updated with like the most recent information. And so at this point, I can't give you a number or tell you how long it's taking. I would just ask for your patience. And if there's an emergency where we need someone assessed quickly, please reach out to us so we can try to get them bumped up in the queue.
Thank you, Erin. I think that goes for a couple of our questions here, specifically for members that may have, like, let's say a 9/1 start date that may have a nurse assessor scheduled for after that date. Certainly, there will be more communication coming out, but if provider agencies or anyone on the call that has this scenario coming up, if you can email that home health box that we shared, that would really help us be able to identify where and how these things are happening. Let's see here. Kate, I see your question here. I'm not skipping you, but I have a particular answer for you, so I'll answer you separately in the chat. I'm just looking at time for us. Laura Neal, she has a great question. She is saying that they have many case managers that are wanting to list everything as personal care rather than HMA to avoid having to refer to the nurse assessor. So they're just looking for what their responses to this should be.
Oh gosh. Okay. And sorry, I'm like getting a lot of calls going on. Apologies. So here would be my statement. The nurse assessor is meant to really support case managers who are not clinicians in ensuring that if someone needs skilled care, we can assess it and ensure that the needs are documented and get those services approved. I feel like if this isn't like up for negotiation, it's like the case manager's job is to do an assessment and accurately depict the needs and ensure that those needs are met through prior authorization. And the nurse assessor, although it's new and it's definitely a new process, it should be more helpful for you. Also, if we've got this happening and you're not quite sure what you need to be doing as a case manager, we've got a lot of training and resources available for you. Again, change I know is hard, but I think we've got a lot of responsibility to ensure that members are getting the services they need. And that does mean if someone needs skilled care, we should be doing an assessment for the skilled nurse assessor. And then the other piece of that is case managers used to approve HMA. So I don't know why it would be much different now. It's just like an extra helping hand. But that being said, I do know it's new. If you have feedback for us and you'd like us to take this offline, we're happy to take it.
Thanks, Erin. We're right on at time, but I feel like the one other general question is just a understanding of how the acuity tool creates recommendations for certain skilled tasks. Specifically, Kurt had asked, let me scroll back up, apologies, that he had heard that health maintenance category to the nurse assessor that was using an AI algorithm. So if we could just clarify how the algorithm was created, I could also throw in our resource document for that. I believe that's where we'll
I
stop
can
there.
take
Yep.
this. So we are not using AI. There is an algorithm in the skilled care acuity tool, but it's very similar to what we do with our direct care services calculator, or like we called earlier, the old task worksheet, where there's times for tasks and then the frequency of the tasks. So in a nutshell, we're looking at the skilled service need and we're trying to assign a time. How long does that take? And then there is a place where we can take in other considerations. So if it takes longer than what we're thinking it might, the member can share that and we can adjust accordingly. So the nurse assessor is using the direct care services calculator. So, but they're also talking about other types of skilled care that is a little different than what's on there. So short version, no AI. There is information on our website about how points are calculated, and it's pretty easy to read, but I didn't include that in my packet today, so I don't want to take time away from the rest of the meeting to go through that.
Here, and if we did not get to your question, I'm going to drop in the nurse assessor email box again. So if your question was not met or I'm not able to get to it during our comment, through comments during our meeting today, please go ahead and send those questions over to our nurse assessor team.
Okay, thank you. And lastly, I just want to end with this. I know there's a backlog. I know this is new and potentially frustrating for folks. We do rely on your feedback to improve the process, identify where there are opportunities to adjust or, make some changes. So thank you for those of you who've gone through this and are providing feedback to us. We're really working as hard as we can to make this a successful process. So thank you for your patience. Please bear with us. And if there's something you need escalated, please follow the instructions that Amanda put in the chat. Thank you all. Okay, I'm handing it back over to you guys, Bobby and Kurt.
Hey there.
Hey,
Go ahead, Bobby.
go ahead, Kurt.
All right. Overspending protocol work group announcement. I think, Aaron, is that you with that, or is it Danny?
It's me, Kurt. Danny. I'm sorry, I forgot to sign my name on the agenda to tell you that I'd be speaking on this today, so my apologies. But hi everyone, it's Danny Cross with HICPUF. So just a quick overview. I'm going to have a quick agenda topic here. But I believe it was a couple of years ago now, PDPPC made a recommendation to allow some additional flexibility with the 130% monthly spending limit. We were able to approve the recommendation within PDPPC and then spent quite a bit of time trying to get the rules approved. We were able to do so, and so we now have that flexibility in our regulation to allow flexibility with the 130% spending limit for CDAS. That being said, we need to update some of our policies. We need to update some of our procedures. Namely, we need to take a look at the overspending protocol and figure out where we need to make some adjustments so that that flexibility is captured. And then we additionally need to figure out what our exception process is going to be. Our regulation now states that an individual can't spend over 130% in any given month unless they have approval from the department or its designee. And so we need to figure out a process that makes sense and how those requests can come through and what information needs to be included, etc. And so I'm announcing this here because we are planning on starting a work group in the next month or two. And I want to invite you all who have an interest to participate in the work group. Depending on level of interest, I'm thinking that 10 to 15 people would be a good sized group so that we can get some multiple opinions and fresh ideas, and also so we can keep the group small enough to stay productive. The plan will be to meet probably twice a month for maybe 2 months if needed, and then report back to PDPPC each time we have any updates for process or need additional feedback. So if you are interested in participating in the work group, I would love it if you would email the participant directed programs email inbox. So I'll put that email in the chat. For those of you who don't have chat, if you would like to call us or email, the phone number is 303-866-5638. Or if you'd like to email, our email address is hcpf_pdp@state.co.us. And I'll be sending more information out as we get more progress on the work group. And that's all I have, unless there's any questions.
Does anyone have any questions regarding this? I'm not sure if everyone understands that overspending rule is the state will not pay out more than 130% in any 1 month in this certification period. Although you can do it in other months, the idea is to not save that money up as a Christmas fund or vacation plan, kind of use it as you go. But we did have a request. I just want to give a quick history before we jump into the breakout rooms. Basically, we did have a request by a member who had some severe disabilities and mentioned that when traveling in states for treatment and care, you need a couple caregivers to do that. And therefore, those times they had saved up. However, would need to spend it over 130%. So that was pushed through. And thank you for Danny and everyone getting that through. And I know the state was kind of going through their issues, still are going through their budget issues. So anyone else to join that group, I really would encourage that good participation. Okay. All right. Meeting chat review. Well, I think we got that a little out of there. We haven't had a chat review since we haven't had a breakout room yet. But I think we're getting close for that breakout rooms.
Okay, we are at 2:07 right now. Does anyone want to report in from their work group?
I can do a report out for the CDAS, FMS training. I don't know, the hodgepodge group. I can do a report out for that. Just an announcement for everybody who is here. We have been receiving just some feedback that some of the forms for CDAS and IHSS might be not as fillable as intended, or there might just be some small issues on them. So just want to let y'all know that we have been informed that the forms are not entirely fillable, and we are working on getting those updated and replaced on the website. So apologies for the inconvenience. And if you notice a form is not functioning as you believe it should be, please feel free to reach out to us, or if it's an FMS form, reach out to the FMS vendor too.
Happy to do a quick call out for our IHSS room. So lots of great discussion, lots of great questions. Most or a lot of it revolving around nurse assessor processes and different steps for both case management agencies and for provider agencies. So I just want to really thank you all for that discussion. If there were questions that we were not that we didn't get to while we were chatting, feel free to either, if it's nurse assessor related, I would ask that you send it to that home health inbox. If it is specific to IHSS processes, to give us an email over to the PDP inbox. Otherwise, we shared a lot of links and getting some feedback on some new forms for IHSS. So I'm excited to talk about that next month.
Awesome. And Kurt, would you do the family advocacy room?
I'm going to start off by saying my apologies for the second time today. My power went out for a short time. I lost internet. But basically, we were talking about the something maybe bringing back up again called FAS. I don't know if anyone maybe Aaron's familiar with that way back when. And kind of that in light of the 130% work group. And but basically, I think that was a general discussion. It was a pretty good discussion on maybe finding out more information about things like that. And from there. And my apologies, I don't have more, Bob, because I fell off there by the right at
That's
the end.
okay. I love to get your perspective. The other thing we did discuss is some budgeting tips and how you can work with your individual budget to make it more efficient for you.
Aaron, I see you got your hand up.
Yep, one thing we talked about in the IHSS room and not here was that there is an upcoming meeting on Tuesday, September 2nd from 11 to 12. It's a nurse assessor office hours meeting. So you can submit questions if you want in advance. It's a Zoom meeting, but if you'd like to find out more or get info on nurse assessor things, I put the information in the chat. If you do not have access to the chat or you'd like to find this on our website, it's on the OCL stakeholder engagement calendar, or you can contact Bobby, Kurt, or the PDP team, and we can get the link information for you. I think there's a call-in, but I think you have to register. So please join us next week, and thank you for being here today. Back to you, Kurt.
I have one quick question. I got an email earlier this week regarding where people could find recordings for the meetings. I did go to the website and I noticed last week that the meeting from the previous month had not been posted. I'm just kind of wondering a timeline I can refer to people when they can look at recordings for this meeting.
Kurt, I will take that and see where it is. We should be able to update things pretty quickly, but we'll check on it. It should be posted onto our website pretty soon after the meeting, but it may be stuck someplace, so we will check.
Okay. And anyone else, just so you know, I just did a quick Bing search I just typed in Colorado PDPPC, and the website came up and it would take you to those agendas. It's actually pretty easy to find if you just use a little bit of good Google logic, for lack of a better word. Okay. All right. Hey, we are done, everyone. Great meeting. Don't forget to, if you have any topics, subjects you specifically want to have happen, there are request forms in the PDPPC on those website online. I'll certainly do that. Or of course, you can get a hold of myself or Bobby or
And
anyone.
it is also on your agenda if you're part of the mail team. And if you call any of us at HickPuff or me or Kurt, we will help you fill it out online if needed.
And that's a live link right there on the bottom of the agenda, everyone. So I'll definitely make use of that. And thanks, everyone. These are your meetings. So let's figure out a way to be the most productive we can be. Thanks, everyone.